So today we're going to get together and actually talk about how to better communicate with your loved one who has been in this either treatment or addiction for a little bit of time, because communication can be really difficult. And so Brad's going to bring some pointers of how to better communicate.
Okay, very good. Hey guys, so this is primarily for the family, I think, and it's really how do we interact with the loved one that is struggling in addiction. We have a lot of parents that kind of like don't know how to do that. How do we deal with the past? How do we deal with things that the addict has done or that a family member has done to us? Maybe there's been theft involved, or just watching them go through their process, and sometimes it ends up in incarceration and all kinds of situations that are unhealthy. And so now you're on the phone with them and they're getting better. How do we do that conversation? So from the addict side, the folks that we deal with that are struggling with their issues, there's usually a lot of hurt involved, because they get on the phone with parents, and sometimes parents are kind of like, well, I still see you as this person. I still see you as the one that's dishonest, that's going back to relapsing, or all of those old past behaviors. And so what happens is we get a split, and that's the problem. So I want to talk about that split today and how to resolve that split of your communication with your loved one. So first of all, let's kind of put it into a framework for change, so we all kind of maybe better understand change. So change is based on three things. It's based on grace, truth, and time. So that comes from a couple of psychologists out there, Henry Cloud, John Townsend, who talked about this, that grace is that we give something that is not deserved. None of us deserve anything, really. But in a family situation, what we can give is love, acceptance, and support. And in order for them to change, they will change only in the context of love. The act only change. None of us change outside of love. And so the grace is like really super important. But then the second part is truth. So when we have conversations, we have to make sure that it's based on honesty and that we're talking real terms. We're not talking in terms of, I hope I'll be better, or I think I might do some work in recovery. No, we need to do some actually really truth work here. What are you doing today? How are you approaching your recovery today? How are you progressing today? And then the third factor is time. We all know that change does not come with the flip of a switch. It comes over experiences and learning and time. So if we put change in that perspective and understand it's not a switch, but it's like a dimmer that turns over time, hopefully that will give us a little better perspective of what's going to happen with our loved one.
Yeah, and I'm a huge fan of Townsend and Cloud. I actually got to work with them several years ago, and they teach on this quite often. And one of the ways they say that you can actually expedite time is by doing it in community. And so for the parents or the loved ones is really to make sure that not going at it alone, because that actually increases the amount of time, repetitions, different things like that. And I forget what study that they referenced, but they said it cuts time in half when we actually mourn and grieve within a group and have that support of other people while we're working through that trust and grace aspect. So one huge thing is to make sure, whether it's Al-Anon, group therapy, something that the loved one's going through as well, to help with that aspect.
Right. Totally agree with that. It's all based on our ability to be in a group where you get feedback and support and truth all at the same time, working together. The other part for the family is a commitment to that individual's well-being. So obviously we're saying, well, of course we're committed to their well-being. We're sending them to rehab, right? But it might look a little different than that. So let's talk about a couple of things. Number one is honesty. So when we require our loved one to come up to the standard of honesty, That means that when dishonesty comes in, the relationship stops and we address that issue of what just happened here, right? What was your motive? What was going through your head when you were dishonest with me, when you did not tell me the truth? And here's the agreement is we need to be completely honest with each other. So honesty is number one. Second one is boundaries. I listen on the phone a lot of times to clients that call their parents, and frankly what comes out of their mouth is astounding to me because it can be very disrespectful, but I'm wondering why the parents aren't setting boundaries. So if you were on the street and someone would come up to you and maybe curse you out or use curse words against you, be disrespectful, you probably wouldn't want to accept that. You'd probably set a boundary. It's no different with your loved one. When you're living on the street and when you're going through the addiction process, and there's all kinds of real darkness there, when they come and they talk with you and they bring that with them, that's a perfect time to set a boundary. You know, we're not going to have this conversation with using that kind of language. We need to do this out of respect for each other, respect for me. And so if you continue to use that kind of language, we're going to have to talk another time. Because otherwise they're not getting any structure. They're not getting any boundaries. They're not getting a sense of boundaries from you. And they're not getting a sense of structure of, wait a minute, I have to actually use some impulse control right now with how I speak. And we actually work on that here. We have impulse control days where, okay, how are you going to tell yourself no today? What are 5 ways you told yourself no over the weekend? This is a very important part of changing behavior.
And we get that a lot with the boundaries. One of the main reasons why it's very simple, well, most people can set boundaries. Setting boundaries is one of the easiest things. What we found is it's holding the boundary. And the reason why it's so difficult holding a boundary with a loved one as opposed to a stranger is because we're emotionally involved. And that's another reason why it is so important that we have a community that we're able to bounce ideas off of, to bounce things through, because when we have our emotional filter, if you will, on, it is so difficult to set a boundary, especially in addiction, because all the questions that pop up is, oh my gosh, is this gonna harm them? Is this gonna harm us? What should I do? And so the first thing is making sure that you've got that community that keeps popping up in my mind. Number 2 is sometimes, basically it's the rules of engagement. How do I engage with the individual? Because sometimes if a person doesn't know or they've been walking on eggshells, we found they don't even know how to explore that conversation. So one of the perfectly acceptable methods is to say, you know, I'm not sure how to respond right now. I need a little bit of time to process this, and then let's reconvene, whether it's 15 minutes, 30 minutes, a little bit later, let's reconvene, and then we'll see what that looks like. But for right now, let me take this in. So many times people feel that I have to do something right now, as opposed to, well, let me bounce it off. First of all, bounce it off either my sponsor or my mentor or someone I'm working with, or we have people call us all the time. Hey, what should I do in this scenario? And just having a sounding board, someone to ask some questions, it helps give us clarity. Then we can get back, engage in that conversation to either set or hold that boundary.
Right, yeah, that's perfect. So that the way I see it is that comes under the area of boundaries of my taking care of myself. If I don't get agreement on, okay, so I want you to speak honestly with me and in a way that's respectful. If you don't agree with that, then how do I take care of myself in this conversation, right? Well, maybe I need some time, right? Or maybe I need to end the call. Maybe we need to talk half an hour later. The other part of that is seeing your loved one for what they could be in terms of your vision for them, as opposed to locking them in their past. There's a book out called Blessing by Gary Smalley and John Trent, and it talks about different factors of giving a blessing to your children. Part of that is your commitment. Part of that is seeing their potential. A lot of times we lose that. We lose that vision of their potential. We lose sense of, we may see their strengths and they don't see their strengths because they may have been in this for so long, it's kind of like covered their ability to see their future. But you can do that for them. You can see their future and express that future to them and let go of holding them to the character that they have been in the past based on their history. In other words, we don't necessarily minimize what has happened or say it didn't happen, but we're going to call you to a different standard, which is a vision of your future. Look at the strengths that you have. Look at the abilities. Look at the gifts that you have in your life, of things that you can do, how you approach life, how you love. Let's pack a vision for that loved one and talk about that. And all of a sudden, now you've given the grace part. Now we're back to grace and helping them actually packaged so that they can move forward in the future.
Yeah, and this whole spectrum is an art form. It's not necessarily scientific because there's a dual edge to this. I love that of what is the vision that I have for the person they have and that we have joint together. At the same time, we do want to be aware of the illusion, or I'll say delusion, of the ideal self, of something that is unachievable. And if we're holding this ideal self accountable, we're always going to fall short. And so that's where this art form comes in, of part truth, part grace, and those two aspects together. And it slides depending on where a person is in the cycle, but by utilizing those two together, it's an art form. So there's really no right or wrong. I know sometimes some people will go, just tell me what to do and I'll do it. Right. It's kind of like, well, here's the tools, here's how to use them, when to use them, but it's an art form and it's nuanced. And that's the part that a lot of people, I think, struggle with, of thinking there's a right way, a wrong way, I can't mess up. Listen, anything that we are coming from a pure intention of wanting to love, like you started out with love, typically is a safe place to come from.
Totally agree with that. Totally agree with that. So the last part is encouraging gratitude as opposed to entitlement. And this can be really, really tricky, because your loved one may be saying, hey, I have all these needs. You know, I need clothes, and I need money, and I need food. Well, okay, let's look at that. So if you come from a place of gratitude, you understand that you are owed nothing. No one owes you anything. The world doesn't owe you. Parents don't owe you. No one owes you, right? And so instead of coming from a perspective of, hey, I need an iPhone 10, actually you probably can get along well really good with a $25 flip phone to make calls, right? So it's a change of mind, whereas and it's really changing that sense of entitlement of I deserve just because I'm very special. So let's move back to away from enabling, away from trying to make the loved one just comfortable, and let's make them responsible. Let's make them responsible based on their understanding that what they get in life is a gift, as well as love is a gift. And the correct position to receive that is of gratitude, not of demanding and saying, no, you owe me, or you need to give me this much. And that also ties into their sense of self-responsibility, taking care of themselves, being able to find a job, to hold a job, to be motivated to hold a job. How are they motivated? Because they're not being enabled over here just because we want them to be comfortable. If you tell yourself in your head, I will never let my child be on the street, you've just robbed them of the risk that they must face of staying sober or not. Because you stepped in the middle of the consequences and took away the responsibility. So those are the basic factors. So honesty, boundaries, responsibility, gratitude, and then the rules for change of grace, truth, and time. And I hope that would be helpful.
Yeah, no, that's huge. There's also another book, sticking on the Townsend and Cloud. John Townsend wrote The Entitlement Cure. It's a really good book of seeing some different steps we can take if we are actually conditioning the entitlement unintentionally, and what we can do to change that. Also, as you were speaking, what came up and the thoughts was that actually changes as I take more responsibility, as I actually I shouldn't say force, but basically am allowed to accept my consequences. No one comes and takes them in front of me. It actually starts to change an identity as well, as that we've seen, is the identity goes of I'm able to do more, I'm taking on more responsibility, my choices lead to my consequences, both positive consequences and negative consequences. That's where we start to begin to see the shift of identity, and the individual starts to make that change once it's choice and consequence.
That's good.
Well, thank you so much again for taking the time to come in
Absolutely.
and dropping the knowledge, as they say. Thank you.
My pleasure.